Unmuted, ready?
All right, good morning. We are so sorry.
I can mute your computer.
We are really sorry that we're starting a few minutes late. We had a technical difficulty. The room would not let us join. So thank you all for this month's monthly provider meeting. We will quickly introduce who is in the room here at DDSN. Michelle Fry.
Lori Maness, Associate State Director of Policy.
Harley Davis, CAO.
Nancy Rumbaugh, interim CFO.
Courtney Crosby, internal audit.
Thank you. And with that, we are going to pass it to Margaret Aylwine at HHS to do her update.
Hi, good morning. Let me first check to see if everyone can hear me.
We can't hear you, Margaret.
Can't hear me. Okay. How about now?
Maybe there's a room problem.
It looks like she has the mute on next to her name.
Not on the.
I can't see very well.
I am unmuted. Let me check to see. Okay, it looks,
Okay. Try now, Margaret.
Oh, they can hear, we can't hear. So there's a problem in here.
No, there we go.
Did we just hear it for a second there? We were just hearing Dr. Fine.
let me try again. I believe remote folks can hear me, but in the room you cannot.
Oh, we heard that.
It's going in and out.
Oh.
Just let her talk. They can hear, we can't.
Oh, that's all.
Okay, let me try again. The audience can hear. It appears that at the DDSN conference room, they're not able to hear in the room, so I believe they are troubleshooting that. Still nothing? All right, if everyone can hold tight, I will keep talking and we'll see if the audio can be adjusted for those in the room at DDSN.
So Margaret. Margaret, I'm going to just put you on my computer so that we can hear you. If something crazy goes like that again, I'll turn it off. I apologize, but the speakers in the room aren't working.
Okay. Let me try again. And I appear to have a frozen screen now. Lori, are you able to hear me through your computer?
Yes, I can hear you. Thank you.
Okay.
Sorry.
All right, are we ready to go now?
I'm really sorry for all of this.
Okay, I'm going to pause here until I get the heads up or the go sign that I should proceed.
Margaret, you can go ahead. Can you hear me?
I can hear you.
Okay, thanks.
All right. So now that we got all that out of the way, my update is going to be fairly brief this morning. I do want to give a couple of updates though. Recently, the federally declared public health emergency was extended, we are still expecting, based on assurances from Centers for Medicare and Medicaid Services, that we will receive at least 60-day notice prior to the end of the federally declared public health emergency. We would have expected to receive that notice by this time if it were to end without an additional extension. So we did not receive any indication or notice that it would be ending as of the current declaration. So our best estimate is that there will be an additional extension, given that we have not received notice, but we are actively planning for the time in which we begin to unwind flexibilities that were put into place during the public health emergency. So we will, from an agency perspective, be communicating intent and around the broader flexibilities, of course, with the waiver programs and those flexibilities that were allowed under the Appendix K temporary authority. There is additional time frame for the Appendix K temporary authority. But I think it is also important to recognize, and I will certainly defer to the Department of Disabilities and Special Needs on any guidance that has been issued throughout the public health emergency in terms of case management actions and continuing to ensure that individuals receive adequate monitoring and that they also receive in-person visits when that is appropriate and when indicated. So again, DDSN may have additional information on that, but they have communicated through both memos and instruction in terms of ongoing case management activities. We also are finalizing information that will be forthcoming regarding the legislative increases that were effective 7/1. That is including the 3% increase as well as bonus payments. So anticipate guidance and information coming out in fairly short order regarding those increases. I also wanted to mention, by way of reference, that the current fee schedule, as we have moved to direct billing, current fee schedule for our waiver services.
Upside down on the inside, but the information's good, but you have to flip it over.
This would have
Okay, there may be folks that need to be muted. I'm hearing some background noise.
PJ, you need to mute your computer, please.
Sorry.
Okay, so by way of reference, the fee schedules for waiver services are located on the DHHS website. So please use that as your primary point of reference for waiver fee schedule. That is located, if you go to the DHHS website, there is a provider tab, and then under that provider tab is a listing of fee schedules. They are listed on the CLTC fee schedule, which I believe is the first one in the list. And then also, we are working through additional guidance on single case agreements for those that do have those pending with us. We will be issuing additional guidance on the invoicing and claim completion process for those that have fully executed agreements. I think we have 3 of those that have been fully executed, and we have 1 additional that we will be following up with you on that is pending. So look for additional guidance to be coming for those single case agreements. That from a policy perspective is covered in the DDSN Directive 700-08 in terms of procedures for those. I just want to say I appreciate those of you that have demonstrated great patience as we have worked through this new process. Also, by way of reference, I just want to make note of we had a lot of activity over the past year with waiver renewals and waiver amendments. So I wanted to call attention to those that have been completed. Of course, the intellectual disability and related disabilities renewal was effective January 1. We also renewed the medically complex children waiver. So a couple of items of note, as we do have participants that move between these waivers. We increased the maximum age on the medically complex children waiver to up to age 21. We also added environmental modifications as a service on the MCC waiver. We received approval for the community supports renewal. That effective date is July 1, 2022. And then we also received approval for amendments to the head and spinal cord injury or HASKI waiver. That amendment, as well as the community supports renewal, allowed us to align the changes we had put in place for the IDRD waiver to ensure that service definition updates for those that have residential services, that the ResHab tiers of service were consistent among IDRD and HASKI. Added some new services that are in the process of being operationalized. And also for the community supports waiver, we increased the individual cost limit in recognition of the rate increases that had been cascaded across all three waivers. Those were my formal updates. Thank you so much, and thank you for your patience with the technical difficulties. I will pause just a moment to see any questions. So we do have one question, an update on the recruitment and retention funding. Thank you for that question. We do have a small work group that we've pulled together, a cross section of providers across the HCBS space that have been helping us to inform how we can best approach distribution of that funding. Our overall focus is on retention of staff. We are finalizing our methodology for distributing that funding. Again, this is related to American Rescue Plan Act funding. So we're finalizing our methodology and distribution of what that will look like. So our, again, focus is on retention. We anticipate we should be completing that analysis based on the recommended methodology. Want to thank those providers that have participated in that work group. And we should be identifying the process for that and the timeline in short order. We have an additional question. I may need to get clarification, or I would be glad to follow up individually on questions that are fairly broad in nature. So I'll be glad to take the question that is referencing healthcare in a broad sense, and be glad to get with you individually. All right.
Okay.
Lori, thank you so much.
Thank you, Margaret.
Thank
We're
you,
gonna
Margaret.
move on to the rest of the agenda, and we're kind of trying to work from a laptop in here. So again, be patient. We're not really sure what's going on with the room, but we're having some trouble. So we'll pass my laptop around.
We are excited to just highlight a few new initiatives. I'm sure some of you are already aware and familiar because we've talked about them in commission meetings. I want to first highlight that the Interdisciplinary Technical Advisory Committee has begun actively meeting each week at DDSN in person. We have now had 3 meetings, and as clear recommendations and strategies arise through the IATAC, the individuals who are subject of those recommendations and strategies, we are either interfacing with the provider or the case manager. So we are really excited about that, and we believe it will be a great opportunity to help us better serve some of the individuals who have the most challenging disabilities, and particularly dual diagnosis. The other initiative we want to highlight is that we have received approval from the commission to establish some crisis stabilization. That's going to take a little bit of time to fully implement as it requires hiring. So you'll see that DDSN will be posting positions in relationship to that initiative. This will really help us serve the individuals who have complex behavioral challenges and need to participate in stabilization. As that gets further along, we'll keep you all updated, but I had a big meeting with HR yesterday, and we are close to posting quite a number of positions in relationship to that. And the third initiative that I want to highlight that we received approval from the commission to implement are some grants for cooperative initiative, establishment of co-ops amongst providers. We will be rolling out guidance in relationship to those grants in the very near future, and we look forward to that and seeing if it's helpful to the provider network. We think that it will be a really great strategy to help you all do what you do well. So those are our newest initiatives. And with that, I'm going to pass it over to Nancy, literally pass the laptop to Nancy.
Good morning. This is Nancy Rumbach, and I was just wanting to talk a little bit about the deadlines for our financial, audited financial reports and our ROAPs. They are due September 30th. We did confer with Jeff Saxon at HHS and our cost staff here at DDSN, and with the amount of time and effort that goes into these cost reports, we are not doing any extensions of our deadlines. I believe there's an executive directive that will be going out soon. We will maybe consider some extreme cases on one-on-one base for any kind of extensions, but it's just imperative that HHS get this information by early December. So if they can, if it's justified, rates can be adjusted and be ready to roll out July 1. I think Jeff Saxon is out there. If he wanted to add anything to this, I would appreciate it.
I think he had trouble getting on. Yeah, I think he had some trouble getting on.
Okay. So if you have any questions, contact Courtney Crosby or me. Okay, thank you.
So we did have one question about where information for the grants would be. It will definitely be posted on the website, but we will send out communication and give you more clear information about the grants, how you apply, where to find information about it. So don't feel like you should receive notification when it's time to apply for those. All right, I am next on the agenda with several kind of updates. The residential leave reports should have gone out to you this week for the last month. As a couple reminders related to those leave reports. Number one, if you're not billing through TheraP, the leave used is not calculated for you because we don't have that information. So if your agency is billing through a different method, whether you're using the web tool or some other billing company, if you're billing for leave days, you guys have to keep up with the number of leave days that you billed. If you are billing through TheraP, we're actually giving you kind of a running total. The reports, if you're not billing through TheraP, will at least tell you how many leave days the person has for their current plan year to help guide you if you're billing through another method. Again, it just doesn't give you the leave days used. If you are billing through TheraP, then those will, be like,
those will be ticked down and it'll tell you how many you have left. If you have overbilled for leave days, you need to unbill for those days because it's not allowable. We are providing a regular report to HHS, notifying them of overbilling. So they are aware when folks have overbilled for leave days. We will continue to provide you those reports until TheraP can make them available in the provider accounts. At this point, they have not done the development to make them available in the provider accounts because the future for them is in ISP billing. So they want to get to ISP billing before they update the reporting in that manner. So I apologize that you have to wait for me to get it to you every month, but I'm trying to do it on at least an every 30-day basis. There's a question out here, I believe it might be for Nancy, that says, who do we call to discuss reconciliations for January through March payments? And we were told that there would be an ICF reconciliation as well. And when can we expect those? You have to walk over here. They're not gonna be able to hear you.
I would contact either Carol Mitchell or Nancy Rumbaugh, myself, and I will have to check with her on those reconciliations.
Okay. I wanted to give you guys another update on ISP billing and TheraP. I think I told you last month, the current plan is to roll out ISP billing for SLP1 and individual employment first, because both of those services currently use a standardized ISP. And then several months later, move to ISP billing for the half day service units and the daily residential. We have delayed, obviously, the SLP1 and individual employment implementation, which is going to cause a delay on the others. We're still working through trying to get some things corrected so that the ISP billing will work correctly. Not to get too far in the weeds with you, but to understand where we are. There's a problem with overlapping authorizations. And those of you who have had trouble with individual employment and SLP1 yearly authorizations and that whole total units for the year field that was blocking people from billing, you understand that we had to overlap some offs just to make the billing work. So we're currently in the process of kind of cleaning that up on the billing authorization end. And as soon as we can get everything, we can get to a point where there are no overlapping offs, we're going to insert a restriction that won't allow offs to overlap, because that restriction has to be there before we can implement ISP billing. It's kind of complicated, but that's what's going on. We haven't forgotten about it. We're still really working on it, but there is a delay at this point, and we don't have a target date. So there's another question related to cost reports, Nancy and Courtney. Will cost reports be the same format and be submitted to DDSN just like last year? Is that what you're looking for this year?
Yes, that's correct.
So yes, Melissa. Right, and then my last item on the agenda is I really just wanted to give the group some case management reminders. We went over these in the case management work group on Wednesday, but I wanted to make sure the masses kind of heard these updates. Margaret touched on one of them, which is really around the requirement for face-to-face monitoring. We sent out a memo reminder letting people know that face-to-face monitoring really needs to be occurring for people. There is a flexibility that if there is an extenuating circumstance at the time of a required face-to-face visit, that the case manager can document that extenuating circumstance and do a telephone visit in lieu of a face-to-face visit. But there's not a blanket, you don't have to make face-to-face visits, right? So we kind of sent a memo out saying that. We also have run reports for each case management provider, identifying people who haven't had a face-to-face visit in a really long time. A year is what we used. So we have sent to you and your case management supervisor as identified on the SPM, right, on the SCEI directory, who those people are that haven't had a face-to-face contact within a year, who those people may be, right? So our data is a little bit wonky, which is why we say maybe. Some of these people you may have seen, or they may have just been transferred. You can tell us that. We're asking providers to tell us why people haven't been seen and a plan for seeing them no later than the end of October. So I just wanted you guys to know clearly that that's out there and is an expectation. If you have issues that are very specific in nature about people that you're having trouble making visits with, you can certainly reach out to me and we can talk through those on a case-by-case basis. The other memo that went out recently related to case management was a request for case managers to complete the caregiver date of year of birth field in CDSS. So as we are looking at priorities and getting even legislative dollars related to services to people with aging caregivers, we don't have a way to identify who has an aging caregiver if you haven't completed that field in CDSS. So when we looked at it, we only had like 21% of all records that had that field completed. The other thing is that we know that we won't have 100%, right? Because there's no point in putting a caregiver year of birth in for somebody who lives in a DDS sponsored residential placement. So we're not making it a required field. We just want to make sure that people are attentive to it. We've asked case managers to ensure that they get it done at the next contact. So we didn't want case managers to have to make an additional contact to do it, but they should see people or talk to people at least every 2 months, depending on the kind of case management somebody's getting. So. Who sees the list? So there's a question about those lists that were sent out. DDSN sent those lists directly to providers because we are aware that there are some people on the list that really have been contacted, right? They were maybe a transfer in, or maybe they were a transfer in and they haven't been contacted. So at this point, what we're trying to do is get providers to respond to us so that we can see clearly who has not been seen within the last year, and then we'll move from there. And that is the only questions that we have. So I think Harley, you are up next.
Thanks. Good morning, everyone. So just really quickly wanted to highlight 2 memos that went out recently about directive updates. So on 8/19,
DDSN sent a memo about updates to directives dealing with crisis management, behavioral supports. Those directive updates were approved by the commission in July of this year. And the memo just recommended that providers review the updates and of course, reach out to us if you have questions. As noted in the memo as well, DDSN will be planning a webinar for the fall where we will review those updates and make some suggestions to providers on how to implement changes and answer any questions that y'all may have. The second memo I wanted to highlight went out on 8/25, so just this week. And it was around updates to the directive for DDSN owned properties that are occupied by providers. So those updates were approved at the commission meeting this month. And the memo is just really a reminder that providers who are currently utilizing or have individuals living in DDSN owned properties, you can start following the process that's outlined in that directive to initiate deferred maintenance as needed, excuse me. And it also provides the contact number for the project manager here at DDSN who will be coordinating those requests. So then you have a name and a phone number, as well as that maintenance email address. So there's multiple ways that you can communicate any questions to get started on those maintenance requests. So those are the directive updates. I do have just a few upcoming events and a few additional comments that I want to share really quickly. The Golden Palmetto Award nominations are, the deadline for those is September 1st, so next week. The information on how to nominate a county government was sent out, and a reminder went out pretty recently. So I just wanted to put a plug in to please nominate a county that has provided outstanding support to citizens with disabilities during 2021. That information will go to PJ Priya, our communications director, and it will be awarded in October at the South Carolina Association of Counties meeting. Another upcoming event is the state fair. So DDSN is working with the South Carolina State Fair. There will be 2 events that will be hosted for individuals with disabilities. On Thursday, October 13th, from 10 to basically noon, there will be a sensory-friendly morning. So guests with sensory-friendly concerns are welcome to enter. The fairgrounds, it'll be an hour before the gates officially open to the public. And so the lights and sounds will be lower that morning to help those who have, to allow those who have sensory issues to be able to enjoy the fair. As well, on Thursday, October 20th, there will be an Exceptional Citizens Day, and persons with lifelong disabilities, developmental or physical, will be admitted free. Finally, as a reminder, Direct Support Professional Recognition Week is September 11th through the 17th. This week provides an opportunity for providers to highlight the dedicated, innovative direct support workforce that advance the quality of life for people with disabilities. So we recommend that y'all use that, that week and that opportunity to recognize those DSP professionals that you have at your, that are working with y'all. Just a few other quick things. I just want to thank those of you who responded to the web survey and gave valuable input on how to improve our website as we move forward with revisions and updates. I also wanted to announce that DDSN was received a federal award through the Administration for Community Living for a traumatic brain injury grant. It is called the TBI State Partnership Program. It's a federal grant and will allow us to expand services, resources, and service delivery to those with TBI in South Carolina, especially focused on vulnerable or underserved populations. And so we as an agency are excited to get this really important work started. And then finally, just a plug for quality management. Just a reminder to report in a timely fashion incidents, complete your reporting, add your documents to IMS, do all those good things in a timely fashion so that we can, make sure the appropriate follow-up has occurred. That's it for me, unless y'all have questions. Thanks.
All right, now we have time for questions and additional remarks. So there's a question that says, Nancy, can you confirm the due date for the audited financial statements, cost reports, and AUP is all due on September 30th? That is correct. And wouldn't the 21-22 for so the award nominations for the,
Golden Palmetto?
is it for fiscal year 22 or fiscal year 21? It would be 22, right? Or is it fiscal year? I don't even know.
I think it's calendar year of
Okay, so it's
2021,
21.
calendar year 2021.
And then there's a question about whether the DDSN is going to approach the governor for a DSP week recognition in South Carolina. I don't know, that's something we can,
Certainly something we will look into.
yeah, sure. I think that was it for questions. So if there are no other questions or remarks, Margaret, do you guys have anything further that you wanted to add?
Hi, Lori. I have nothing further to add. Thank you.
All right. Well, thanks everyone for attending, and I hope everyone has a great weekend.